Grounds for Discussion. I'm your host, Patty. Tonight, my guest is my dear friend, Terry Swenson. And Terry, I'm going to flip the cameras over to you and we'll talk about what we're going to talk about.
Hey, thanks, Patty.
You're welcome.
So good to
see you
be
again.
here.
Yeah.
I love it. Yeah, tonight we're talking about mental health. Should introduce myself to the crew
let's
out
do
there. All right, so my name is Terry Swenson. I'm a registered nurse and I worked for Lake Region Healthcare in Elbow Lake and a specialty program called Senior Life Solutions where we specialize in the mental health of older adults. So this month is Mental Health Awareness Month and it's Older Adult Month.
Oh,
so
it is.
Perfect time to talk about mental health.
Yeah, for sure. I didn't know it was also Older Adult Month. What kinds of things does your program then do for the older adults and bringing that together with mental health?
Yeah, so we kind of cater to that group, that age group, and so we focus in on the issues that older adults are having. Things like loneliness, loss of a spouse, maybe having to move out of your home into a different setting. Maybe children are further away, they're not helping as much as maybe you'd like them to, or maybe they're in your business because they think that you're not as well as you used to be. And so we know families can be complicated at times, so this is where we can step in and offer some family counseling along with individual counseling for the person and a group setting so they can learn from their peers and form friendships.
So is there an age range that you service through your program, or is it, like 55 and up, or which, Terry, I have to tell you, I'm going to take us kind of off course.
Okay.
I am now 56, and I have found I qualify for senior discounts. That's horrific. So
Wow.
now I've hit that 55 age range and
Yeah.
up, so now I'm qualifying. Back to your program, what age range do you guys work with? Is there a specific?
Well, generally we look at the Medicare age range, so that's 65 plus, but that doesn't necessarily mean that we won't look at somebody who's a little bit younger if they're struggling and they would fit into the group dynamic. I think they would, definitely benefit.
And this is Lake Region Healthcare,
Correct.
and you are located in Elbow Lake.
Our office is actually in the Elbow Lake Hospital.
Oh, okay. And then your program is structured how?
So basically 3 days a week for roughly 3 hours a day, and there's breaks in between. So we look at that as well. We don't want to exhaust anybody, right? But from about 9 o'clock in the morning, we start. Group goes for about 45 minutes or so. We take a 10-15-minute break and resume another 45 minutes of education. And then the third group as well is 45 minutes. And then we have lunch afterwards. So it's a time of socialization. It's a time to get a good meal. It's a time to form friendships, learn about each other personally if you want. And it's great.
So it's rather structured.
Yes, it is.
Okay, which I think would help.
But not formal.
Okay. Well, that's good to know too. Not formal, but structured, and for individuals dealing with the loss of a spouse, sadness, depression, anxiety. Is it just loss of a spouse, or is it other life-altering situations that can bring a person in?
Yeah, absolutely. Anything that would change maybe the way you think about your life as an older adult, maybe a health concern. As we age, we know that our health isn't maybe as fabulous as it used to be, and maybe you have a hip replaced, or maybe you had a heart attack and you need to have rehab. You weren't expecting things like that, so they could have an effect on your mental health.
Yeah, for sure. So do folks hear about your program? How?
Well, we have advertising out there. Lake Region has done a wonderful job of promoting this unit of their facility, and people can self-refer to this. It's not something that they need a doctor's permission to join. They can join on their own. They can talk to their doctor about it. Maybe their doctor would have recommendations, or maybe a friend can refer, because if you're confiding in a friend, they may have concerns and say, hey, why don't you look at this program? It might be something that fits your need. So,
Is there a length of program, or is it what the individual need ends up being?
it's all based on somebody's personal needs. Generally, we start with 30 treatment days, which is approximately 3 months, but it can be less or more depending on that individual.
That's 30 days of treatment,
Mhm.
and it's typically 3 days a week, you say?
It can be up to 3 days a week.
Okay. So when someone goes a first time visit and starts the program, what does that look like?
So we bring them in and talk to them about their life. I want to hear their story. So basically, with that story, we can do some cognitive testing, we can do some mood testing, we do a suicide risk analysis, and so we can.
To that suicide risk analysis, and really any of the tests that you do you feel that folks are honest? Do you think?
For the most part, people want to tell their story and they want to be heard. So I do find that people are pretty honest with that.
Have you had a situation where someone scores very depressed to the point that, can you discern that from a test that someone is depressed, perhaps significantly depressed, and perhaps we should get them treatment outside of this setting?
So with our test results, we have our psychiatrist look at that right away. And so if there is something concerning, we refer that right to the physician. She can look at it, maybe meet with the patient immediately, start some services. And the nice thing about this program is we can start services generally within days.
That is actually pretty swift
Yeah.
and fast moving and very patient centric, that you can take
Yep.
someone, have them take these exams, these tests, and turn around and say, hey, well, you should meet with
Absolutely.
someone.
Well, and if you think of somebody that maybe had a life event, or even if they're in a caregiver role, so the life event wasn't necessarily theirs, but their loved ones, it can be very stressful.
How many folks are in a session?
Up to 10.
Okay.
So we keep the group small, we keep them very close. And that seems to work better for a lot of folks because they can get to know the people in the group.
And is it specific to, say, female, all in one group, men all in another, or is it?
We mix, but
good.
ironically, we seem to have more men join our group recently than ladies. So I don't know if it's a trend. Maybe it's catching on, but it is nice to see that both groups are reaching out and getting the help they need.
Do you feel the program has grown in the last year since you and I last sat down and talked about your program out at Lake Region?
I do think it's getting known more, and people are able to ask questions about it and understanding it a little bit better.
So Mental Health Awareness Month is May,
Correct.
and your facility, what kinds of things are done in the community other than what you do on the daily basis to reach people?
Yeah.
Is there something outside of that that you guys do for the month of May?
Yeah, absolutely. We've partnered with some libraries to set up books that
Oh,
specifically talk about mental health and promote those books. We do education throughout the community, so we have speaking engagements. We go to some facilities and play bingo and educate the people there about mental health. So we are out in the communities and we're reaching people.
Yeah, it kind of sounds like you are, for sure. As you're out in the community, have you ever come across someone that you felt, and so I'm kind of trying to get a feel for mental health seems like there's a stigma around it, like people don't want to talk about it. They kind of want to, you know, shift the focus to something else. Do you encounter that when you're out in the community?
Yeah.
And how do you get those folks to be okay with needing help or talking about mental health, which is something we all have, right?
Right.
Okay.
Well, I think as far as our organization, we want to dispel the myths, right? So there's a lot of myths out there. There's also a lot of old thinking where my personal business is only my business, and maybe to a point, but when it comes to affecting your mental health, there are ways to reach out, and there's things we can do to make it better. We don't have to suffer in silence.
Right. I feel like that's a big thing. I believe with an older generation.
To a point.
So my husband Sean, and he is, and I might get in trouble for saying this. He's almost, and I'll say that, almost 10 years older. And in just that small age gap, there's a big difference in the privacy aspect. Like, I'm more of an open book with people, with friends, folks we meet. And it was even hard when we were dating 17, 18 years ago. Because I noticed that he was way more closed off than anyone else. And I attribute that to his generation, almost a 10-year gap.
Yeah, so we know that that generation tends to be a little bit more private. That doesn't necessarily mean they can't seek services, right?
Yeah, for sure.
Yeah, as with any medical care, HIPAA compliance is in force, and we do take that very seriously. And we encourage people to learn more because as we break down that stigma, a lot of the privacy is revolving around the stigma that goes with mental health. As we know, in times past, people with mental health concerns weren't treated as well as they are now. And so things weren't addressed. And so now that we can address those concerns, we can use talk therapies, we can use medications, a combination. And so people can actually get better help and get better faster with the combination of treatments that are out there today.
So if you can, walk me through a generic patient presenting to your program, and they have depression, as an example, and they've then participate in your program, do all the things that the care team advises.
Yeah.
What do you notice in that patient generic from the time you see them to the time they've completed the program?
Generally, we see a lot of really good self-confidence and progress. All patients are different, and it depends on their level of depression, anxiety, other health concerns, and sometimes other health concerns can be limiting. If somebody ends up in the hospital for a physical health concern in the middle of their treatment, they may have a setback, and then we go back and support them where they're at again. Generally, we see a lot more uplifting behavior, a lot more excitement for life. We can definitely see the difference. And because we're working on therapy 3 days a week and people can be there 3 days a week, we see that progress a lot faster than maybe some of the traditional routes that were maybe once or twice a month.
Yeah, I would think that does make a big difference in being able to. There's the basic aspect of connecting with another individual, just the basic humanity in that, I think would be a big deal, especially for some of these folks in the rural areas. Do you see the rural kind of isolated because of location and age? That probably does make a huge difference for that patient's care.
Right, and as we age, we sometimes quit driving. And so isolation becomes a very real part of older America, right? Especially in rural areas, maybe you're outside of town 5-6 miles. Well, you're not going to walk to town, obviously. But if we can connect that person with a medical ride, they can come to class, they can be part of a group, they can become re-engaged in their community. And that's a big deal because we all need some kind of social engagement.
I'm learning that more and more myself. I used to think that being quote unquote independent and not needing anybody was a sign of strength. I don't think it is. I think, and I'm learning as life goes on, and kind of being here at the coffee shop full time has taught me that people are yearning for interaction
Absolutely.
with another being, another human, just to share. I find the load that they're carrying, exactly what you guys are doing out there in rural Minnesota, but a very structured approach to help these individuals that just probably is of such benefit to just connect.
Yeah.
Put the therapies aside, put the potential medications, prescriptions. The fact that these folks can come and visit with someone like Terry, as an example, I feel like you've got a very comforting, soft approach and just super wanting to pull them in and understand where they're coming from. And I know that from knowing you for so long, that has got to be just tremendous benefit for people.
Well, in our group, so the staff within our little unit of the hospital is small. There's 3 of us. So they get to know us very well. They're very comfortable having us around. And so we then become part of their treatment plan, part of that socialization. And I have patients that have graduated from the program and are doing well, and they'll stop in and have coffee.
Oh, that's so nice.
And it's so fun that we're just casual and we can have that kind of atmosphere that somebody can just stop in and say hi and grab a cup of coffee, sit down for 15-20 minutes and just, catch us up on life.
Oh my gosh. I think that's such a testament to the work that you're doing, because I think of myself going to see my provider.
Yeah.
When I'm done, I'm done. I don't want to go back. I want to go in, get my labs done, get my work done, and whatever I need to do, okay, great, and then I'm done. But this is very much a human connection perspective and treatment for these individuals that they actually come back and visit with you and have coffee.
Yeah, it's really fun.
Yeah. You're making an impact then.
Yep. It's definitely the best part of the job.
Right.
Yeah.
I imagine it is. How long have you've been a nurse for a long time?
Yep.
Mental health?
So I've been in and out of mental health most of my career. And as a hospital floor nurse, even if you don't wear the mental health badge, you're doing mental health every time you walk into a patient's room. But I've worked for other mental health facilities, and this one by far is the best connection I've found.
That's great.
Yeah.
So if your individual, you said this earlier, I'm going to back up to this,
Okay.
is not able to drive, you guys can set them up?
Yeah, so we look at what their insurance will provide. If we can hook them up with a medical ride through their insurance, maybe we can get a volunteer driver from neighbor to neighbor or use other community resources, we can do that. Sometimes we can offer a ride, but I can't guarantee that. We do have a company vehicle. We will always look at other options first and exhaust those options, of course.
You guys will find a way to make it happen.
We will.
To connect the dots with those that are unable to come in for treatment. You're going to find a way to get them there.
Yes.
That's pretty amazing, actually. And I'm imagining the community resource that you're able to pull from is by far and away way more than someone like me, a lay person, could do.
Yeah, we have some pretty good connections.
Yeah, that's so great. That's so helpful for them.
Yeah. And the other part of the program that's really great, say somebody has surgery and they're worried about infection risk, or maybe they have a cough and they want to stay home. They don't want to bring that to the group. They can join with just their smartphone and the Zoom app.
Oh, you're kidding.
No, it's great.
Oh, my, I see. And of course, Terry, I should not even be surprised at that, given our background together with where we used to work together and the EMR aspect of it.
Yeah.
And you could just connect the dots. I didn't even consider that as an option for these folks to be able to connect with the smartphone. Do you find that the older generation has grabbed onto the smartphone thing?
For sure.
Oh, good. I'm so glad you said that. I'm like, is she
It's-
going to say yes? I was hanging on
Oh
your
my gosh.
every breath. Is she going to say yes or no?
No, it's really great. I mean, some are a little bit nervous because, you know, they know how to make a phone call, but that's about it, right? It's so empowering when we teach them how to use the app. We do test calls with them. We can even be there for their first time on Zoom. So joining the group, we're in their home with them if they want, and then we can make sure they get connected, and then we'll go back to the office and let them be part of that group.
Oh my gosh, that is quite a service
It is.
that you guys are providing to
It
be
is.
able to work that closely with. Do you guys call them patients, clients,
There are people.
your people? To be able to work with your people that closely that, hey, let's do a test call.
Yeah.
If you're comfortable, I'm willing to come to your home
Yeah.
and teach you how to use this device.
Yep.
That's really cool. I have a gal that comes into the coffee shop and she's probably 70 and her mom is in her 90s
Oh, cute.
and she uses her smartphone.
Yeah.
It's so fun to hear the stories of her 90-plus-year-old mom. Look like she's the encyclopedia. She
Yeah.
lives in an assisted living.
Yep.
And so they'll go to breakfast, the unit, I'm assuming. They'll go have breakfast, and in conversation, things will come up, and she'll say, by lunchtime, I'll have an answer for you. And my coffee shop, I was going to say resident, my coffee shop customer will share that mom will go back to her room, get on her smartphone, and Google and have an answer for the group
Oh, I love it.
at lunchtime. So I'm so glad that your people can have the ability to access
Yeah.
this care that they need.
Yeah. Well, and you should see, like, if they're concerned about being able to do it, the empowerment that goes into that education,
Right?
and them being able to do it on their own is, oh, it's so perfect.
Oh, that's so good. You know, I always try to, when you describe that experience of them connecting and how that makes them feel, I always try to find a parallel in my life
Yeah.
to imagine what they must, to find that empathy, I suppose. And I think about me figuring out how to upload videos to Instagram.
Oh, sure.
Like, yeah, I got it. I can do this. At my age, I can figure this out. So I imagine that they feel
Very.
so
yeah.
good to be able to connect with the care that they need. And I would think it makes it maybe not easier, and maybe easier. It does make it easier for them to seek and get the health care. Is there anyone that doesn't want to come in and mostly is using technology?
Generally, our group has been remote, as we call it.
Sure.
So using the Zoom
Yeah.
for medical issues. So, I have dialysis today. I can't make it. Well, if they put you in a private room for that, we can still join you.
Oh my
Or-
gosh, you guys really do
Yeah.
and work at connecting the dots no matter where.
Yeah, we'll work with them.
That's what
It's
you want
absolutely, yeah, it's absolutely amazing how much we can do as long as they have a private space and as much as a smartphone. I mean,
Sure.
a computer
This
in their
big,
pocket. Yeah,
right.
absolutely. It's great.
Wi-Fi, smartphone, privacy,
Yep,
and you're
and you're in.
in.
Yeah.
That's so good. And I'm glad that you guys are reaching the older generation and willing to work with them to get them connected.
Yeah, absolutely.
So, in all of the different areas that you've worked in healthcare,
Yeah.
do you say this is where you should be? Do you
I would say this is my favorite place to be.
Oh, good.
Yeah.
I would imagine you feel like you make one heck of an impact.
Yeah, most days.
Yeah.
Yeah.
Challenging days, I'm sure.
Sometimes, but you know what? The reward is worth it.
Yeah. And what is your role at I always get it confused. Lake Region Healthcare?
Correct.
Yes? Okay.
Yes.
What is your role and title there?
So I am a program director. So basically, I take care of the RN needs. I do education, nursing education, and then I do day-to-day operations.
You got a full plate. It
A
sounds
little
like.
bit.
Yeah.
A little bit.
Yeah. And you guys have therapy 3 days a week for these individuals.
Yep.
And is there ever a way for patients, clients to connect in the event of a crisis situation?
Absolutely.
Oh my gosh, do tell.
Okay. So if they're having a bad day, they can give us a call. We'll talk through it with them. If it's something that really needs the physician's attention, we can have them connect with that physician. Normally, generally within a few minutes, she'll finish up a call, maybe she's on, or with a patient in a crisis situation. We can keep them on the line until she can join in on the call. If they're in our office, maybe they presented to the ED, we can go see them in the ED. If they're in their physician's office, they went to see their primary care is saying, I don't know, this just doesn't feel right. We can go sit with them, we can talk to them. If the primary care thinks they need more, we can connect them with that psychiatrist. So there are ways to help them out in that situation.
And that situation does happen, but it sounds like you guys are ready and willing and able to handle
Yep.
those crisis situations.
Right.
Hopefully they're few and far between, but
And if things get more advanced and they need stabilization, we can have involved people like Region 4. And so with the patient's or the person's permission, we can have Region 4 go out to their house, talk with them, sit with them. If they're consenting, we can send an ambulance. We can have the local sheriff stop in and do a welfare check.
okay.
So there's safety measures in place.
So with May being Mental Health Awareness Month, is there a list of maybe the top 3 things you would want to tell people on two sides of the coin, those dealing with mental health issues and those lay people like me now? What would you want to tell us about mental health? And then from the perspective of someone needing help or treatment.
Yeah, don't delay. So we want to get rid of the stigmas as much as possible. We want you to seek help. We're a great, friendly group, and so it's not as scary as it seems. It's pretty easy to get enrolled in a program, and even if you find that our program isn't right for you, we'll help you find one that is. So there are great resources out there. Don't be afraid to ask. And for the person on the other side, maybe the caregiver, the lay person, whatever, if you see something, say something. Don't ignore symptoms.
In the younger generation, I hear and I've heard that there are things that are said that are a cry for help, such as, or actions that are taken. And I think of, things I've heard even here through the coffee shop that, as an example, my friend was self-harming. That was a cry for help. Does the older generation, the population that you work with, have different cries for help?
I don't think they're necessarily different. The one thing I will say about the younger generation versus the older generation is they'll put it on social media. The younger generation goes to social media to air things, maybe puts their cry to help out there, or maybe we'll talk about it more openly. We don't necessarily, sometimes we'll see that in the older generation, but don't necessarily see that. We don't see them getting on social media to talk about, what happened last night or how they're feeling today. So
that has to be a big difference in how folks come to you. Whereas the younger generation, and you're absolutely right, I've seen it on social media. I know some of my employees are in group chats, and there's a lot of chatter going on, like different social media platforms where they can connect with their peers and vent and get stuff out. With the older generation, like you said, there's not a whole lot of that. By the time they come and see you, is it pretty heavy?
it can be at times, but I think families are recognizing things.
Oh, good.
Mom's not quite what she was before we moved her, or, well, she fell and broke a hip and now she just seems a little bit off. And I think when families describe their loved one as a little off,
Sure.
we're talking about signs
yeah.
of maybe depression.
Sure.
It definitely needs some analysis. What is a little off?
Yeah, what does that mean specifically? Sure.
Right.
Okay. Mental Health Awareness Month, May, and today is what, May 7th?
Yeah.
What is next for your organization? Do you have any speaking engagements coming up?
So we have kind of a calendar going on.
Oh, great.
We're going to be at Ashby at the Triad meeting here next Tuesday, I believe.
Okay.
And then hopefully we can join the Alexandria Mental Health Walk here on the following Friday. And we have things going on throughout the month. The 21st of this month, all of Lake Region Healthcare is wearing green to recognize and promote mental health awareness, and just some fun stuff going on throughout the community.
So I have two closing thoughts. I'm going to back you up to the Mental Health Awareness Walk that takes place in Alexandria.
Yeah.
What day is that?
That is next Friday, so I believe the date is the 15th.
Yes. Yep.
For Viking Land is hosting that, as they do every year. And so that's a great time to come out and be aware and support people that are having mental health challenges, or maybe a caregiver that is caring for somebody with a mental health challenge, or just support your own mental health.
Does some of your team come to that walk then?
We did last year, and we're going to try to do it again this year. And so far, we have it on our calendar. So.
Oh, good.
Yeah.
Yeah, they get a very good turnout, and it's very visible if you're out in the community during that time.
Yes.
The community does. They show up in green.
Yep.
And I believe last year was over 100 walkers.
Yeah, it was a big group.
In the rain.
Yes.
It rained quite a bit last year, so I think that's a great event. For sure, to raise awareness. Now, stigma.
Yes.
We've talked about that, and I see the posts across social media and different organizations and nonprofits that work at raising awareness to mental health. The stigma, how do you guys combat that?
Education.
What are things that even me can do?
If somebody says something that's not true, obviously you want to correct that information. And then that's why we go out and we educate the community. That's why we go to speaking events, because we don't want there to be a stigma, because stigma is based on false education. And so that information that's out there, that's floating around, that's not true, as we know, it can be damaging, hurtful, and we want that to stop, and we want people to seek help.
Sure.
Yeah.
So it's really about having a conversation.
Yeah.
And in that conversation, there's always our smartphones that we can reference, or we can phone a friend.
We can phone a friend.
My friend Terry, if we have, because a lot of people, I think, have like an aged perception of mental health. Like,
Yeah.
especially I would think in the older generation, some stoicism with the thought of having depression, even myself. And I guess we're going past two thoughts and two questions to close it out.
Yeah.
So once upon a time, a very long time ago, I went to see a therapist
Okay.
for what she diagnosed me with as depression. All these years later, and I was only 18 at the time, I don't even know, and you can tell me, I didn't see it as depression then. I saw it more of a situational situation.
Yeah.
My dad and brother had just been killed in a car accident, and she said to me, "Well, you're very depressed." I said, "Well, no, I don't think I'm depressed." And I had just had this immediate, and I remember it like it was yesterday, this immediate, like, don't tell me I'm depressed, like something's wrong with me. Her approach to me, I felt like she was saying, "Well, you're depressed." Well, I'm sad. There was a big difference to me, and that kind of shut me off from ever wanting to display sadness or emotion because of even that
Yeah.
finger pointing, which I think has kept me in the not the mindset, but I can see where stigma would be a big thing, because as this kid, someone saying, "Well, you're depressed." Well, yeah.
Unfortunately, maybe her approach wasn't right for you. So, low mood or sadness is under what we call a DSM diagnosis of depression. So, there can be many things under that depression diagnosis that people exhibit. And it's not necessarily that you feel so sad that you're laying in bed all day,
Right.
but you could have a low mood for an extended period of time. And there's nothing wrong with getting help for that.
Right. Do you think, now this will be my closing question, do you think as time has gone on, and this is what, 30 plus years since I had that interaction with that therapist,
Yeah.
do you think from the therapy perspective, the professional perspective, it has gotten, I don't know if it's more compassionate, the word that I'm looking for, but a way to interact with the patient so as not to have them feel like they've done something wrong?
Well, I think the evolution of mental health care has come a long way. And so, I can't speak for your situation because I didn't know you back then and I didn't know your therapist. But I think, there's a lot of people out there who do a really great job. And there's no harm in, if you don't connect with a therapist, finding a different one.
Yeah, that's a great point for sure. And from my experience on the fringe in healthcare and mental health, I think that in general people have a understanding, like healthcare providers have a compassion
Yeah.
that perhaps wasn't there all those years ago, or I think a big light bulb went off in that the connection with this individual wasn't there, and it's important. And I think I know you do recognize that, and I don't think you would hesitate to tell
Yeah.
a client, "Hey, if we can help you," and you actually said it earlier
Yeah.
in conversation, "We can help you find someone
Yeah.
that you can connect with."
Absolutely.
And that's huge.
It is.
Yeah.
If you come and you try the program and you feel maybe it's not right for you, there's definitely still help out there. We hope that we can be the ones to help you. But in the end, it has to be what's best for the person being treated.
You say that with a genuineness and a sincerity that I know is legit because I've known you for so long. Any closing thoughts on Mental Health Awareness Month or what your program offers, or is there anything you just want to like, guys?
Put me on the spot.
Yes, right? Yeah, you can thank me later.
Okay. I just want people to be aware.
Yeah.
You know,
Yeah.
we're stopping the stigma, we're raising awareness, we're getting education out there. And this is a great place to start if that's what you want to do. And we welcome everybody who wants to come in and try the program. And I love it.
Yeah.
It's a great place to be.
Yeah. I'm so glad you guys are there helping our rural community and our older population seek the connection and the help that they deserve.
Yeah.
We all do, actually, if we get to that point in life.
Yeah.
It's nice to know that the help is there.
Yeah, and especially with this unit, Senior Life Solutions is specializing in older adults. We cater specifically to the needs of the older adult. And so having like-minded people in your group, your peer group, so you're not having a 20-year-old
Right.
with a 60-year-old,
Right.
I think that lends something to the conversation.
Most definitely. Well, I appreciate the work that you do and the passion that you have for it. Last year, folks, Terry was here in May to do a conversation, a podcast on mental health awareness with Lake Region Healthcare. If you find this podcast on Facebook, I will post that episode in the comments. And then, Terry, you came back in August.
Yes, for September is Suicide
Okay.
Awareness Month.
Yes,
Yes,
yep.
so we were back and we had a roundtable discussion.
That was very eye-opening for me, and I hope that we can get a group of folks together and do another roundtable conversation on raising awareness for suicide.
I think we can do that.
Yeah,
Yeah.
that was very eye-opening and educational for me. So, folks, thank you for tuning in. Grounds for discussion. If you don't mind, hit that subscribe button and follow along. We are also out on Facebook and Instagram. And as always, we're coming to you from Streetside Studio 7, located inside Deja Blue in Alexandria, Minnesota.